employers, if you do not like how much you're having to pay for healthcare and your employees don't like the healthcare they've got, there's a different approach with drastic results. And all that you got to do is contact Paul Seegert of PCS Advisors, and they're at pcsadvisors.com. He's an expert in the area of healthcare. He thinks outside the box, and it saves money and increases benefits. Paul, welcome back to the show.
Thanks. How are you today?
I'm doing good. Thank you so much. Hey, before we dive into Obamacare and the dirty little trick they're playing on everybody and their mother, especially the taxpayers, I've been meaning to ask you about this announcement coming out of Sacramento that they're going to try to pass a bill, a constitutional amendment, which will have to be voted on by the people to become law. And it has to do with the single-payer healthcare system. So we've covered on our show the taxes. The lowball figure is $160 billion. Other people think it'll be more like $400 billion. But what we don't know, which nobody knows that I've asked so far on the radio show, is the cost of health care is dependent on how much they reimburse the providers.
Right.
Whether you get an x-ray, a lab test, surgery, doctor's visit, prescriptions, et cetera, have you heard anything in terms of what the reimbursement rates would be? Because that's going to determine not whether it's affordable for the person, but whether it's affordable for the healthcare providers.
Well, I do. You hit a nerve for me. I'd love to talk about that, and it is something I know something about. What we have recurring conversations across our country in different states that are like California about whether we should do single-payer health care. And there's so many parts of the story that don't get told. One of the places that I end up speaking kind of regularly is a radio station in San Francisco, and for some reason they keep asking me back. And we had the conversation there, and I can kind of condense it down into a few things, but the big issue that I see with the single-payer healthcare laws that have made it this far in a few states around the country is that they aren't looking at the real big picture of how we actually fund our healthcare system as a whole in our country. You have government payers, let's say Medicare, Medi-Cal in the state of California, and then you have private payers, you have employer plans, you have the exchange plans. So you have all these various payers that pay some very different amounts for the same procedure. I'll give you an example. I was looking at a heart procedure that would be done at a facility in Central California, a Sutter hospital, but it could be true anywhere. For the same procedure, the same surgeon, the same operating room, the same support staff, and the same procedure, it would get billed anywhere between $80,000 and $540,000, depending upon the payer. And so what we have is a situation where what it's evolved to is government payers underpay providers, which is why when the exchange plans came out, you had 50% of doctors in California say, I will not accept those. And then, so they underpay, the government payers underpay, and then the only way for these providers and hospitals to survive is then to make it up by overcharging employer-sponsored plans primarily. So you'll have an employer-sponsored plan in that heart example that's paying $540,000 because they have to make up for the fact that the government is paying $80,000 for that procedure. And that's kind of a high-level look at it. But if you look at Medicare reimbursement rates, Medi-Cal reimbursement rates, most hospitals will tell you that they lose money on those procedures. They need 118 or 120 of what they get for those procedures to turn the lights on. That's before profit gets made, before the superstar surgeon gets paid and all this stuff. It's 118, 120%. And so when they do the projections on these programs, the Senate, the last time around in 2017 that this came down in California, they scored this in the Senate, the state Senate, and they scored it at $400 billion. At the time, I think the whole California budget was $200 billion. Now we're up to about $265 billion. So they're scoring it based on underpaying all these providers.
Exactly. The whole thing collapses under its own weight.
Yeah. You're going to lose all the good providers. You're going to see what we see with the Canadian system. People are coming, and it's not a couple of people. We're talking a lot of people come to the states that can afford it because they may have a wait time for urgently needed cancer treatments. When you're in this, you're going to ration healthcare one of two ways: by a line or by price. We do price currently, and the places like Canada do a line, and so that results in a rationing of care where you have wait lists. So it's not unlikely that you would wait 12 weeks to get an MRI or a CT scan that we are accustomed to being able to get literally immediately. It's not unheard of. In fact, it's pretty common that you might wait 3 months to get a referral to an oncologist for urgently needed cancer treatments. And what could happen during that 3 months? I mean, it's not fear-mongering to say that people die because they do. So their mortality rates, a lot of people that are proponents of the single-payer systems talk about things. They kind of misuse data. What I think is most important is, what are the outcomes when people actually go to seek care? How do we track the data? I'm at risk of getting too nerdy here, but how do we look at the data when they go to seek care? That's like, what are the survivability rates for things like prostate cancer, breast cancer, et cetera? We win in our current system. And when it comes to things, they'll often cite mortality rate. They have a better mortality rate, infant mortality rate, I mean. We track it differently. Here, if you're born alive and you die 60 seconds later, that counts. In many of our peer countries, you have to live a lot longer than that, or they don't count it as a live birth. So there's just the devil's in the details. But if you want to wait, I mean, it would be the equivalent of having 6 or 7 million people on a waiting list for serious procedures right now, if we took metrics from Canada and applied them to the California population.
It's just crazy.
People that aren't getting surgeries, they're not getting cancer treatment, they're not getting CT scans, they're not getting so many things. And so it would be a study in watching people start to travel to Arizona. We would see medical tourism within our own country.
Well, the other thing, Paul, is, what I mentioned yesterday when we were discussing this, Gavin Newsom is literally putting up a sign at the Mexican border and any other border saying, come on in, it's free. It's all free. And you want to talk about jamming the switchboard, so to speak, trying to get appointments. What happens if you open it up to another country, no questions asked?
Right. Yeah.
All right, we got to take a break. When we come back, Paul's going to tell us how the federal government is completely cheating on Obamacare, how they're lowering premiums by subsidizing the premiums. In other words, they lowered premiums by raising taxes, in essence. Paul Seegert, PCSadvisors.com. We'll be back. Stay tuned. I'd like to welcome you back to the show. My guest is Paul Seegert. He's a nationally recognized expert in the area of healthcare, managing healthcare, different approach, drastic results. Just contact him at pcsadvisors.com. Paul, we were talking before about statistics, and there's that old saying, I always butcher it. There's lies, damn lies, and statistics. And that's what I was thinking of. Sally Pipes has been on our show a few times over the years. She wrote a piece at Forbes. You summarized that for our conversation today. And the bottom line is Biden and company want to say that Obamacare is a great success. Look how many people are signing up for it. Tell us the dirty secret behind those headlines.
And I am a big fan of Sally's. In fact, some of the stats I was rattling off on our last conversation were from books and articles that I've read that she's written. And I want to make one correction because I want to make sure I'm always being accurate. It's 700,000 that would be on the waiting list, 700,000 Californians. I added a zero, I think. So just to be accurate. But what they're doing when it comes to Obamacare is, as part of the rescue legislation around COVID, they ended up adding a lot more subsidy to the program. And what you have now is, or what you had was that if you make less than 400% of the poverty level, or $106,000 for a family of four, then the federal government's going to pick up the entire premium. And then as you rise, as income rises, that there's a sliding scale, but the most you'd have to pay would be 9.8% of your income. And what they did in real simple terms is say, let's make it so no one has to pay more than 8.5% of their income. And it really added a lot of cost to the system. And so now you could be in a situation where you could have a couple making $212,000 and you can get a subsidy of $11,000. And what we're seeing is a lot of the people then that got added to Obamacare were actually people that, because it's really the definition of moral hazard in our business. You created a situation where you drew people into that program that already had coverage and already had private coverage. So now the government is paying for coverage for folks that already had it, whether that was through an employer or something that they got individually. And the government is the worst one to pay for this stuff because it kind of ties into what's happening right now with COVID testing. There's a shortage of testing. It's really our own fault through mismanagement of how we've approached this. And so the solution is to come out and say, don't worry, it'll be free. You can get 8 free COVID tests per person per month through your insurance. That means to me, when I hear that, all of a sudden manufacturers know of tests, at least when they sell them in the U.S., they're not going to be competing on price for consumers to buy their product. They're just going to overprice it because it'll be invisible to the consumer and pass it on through to the consumer. So the same thing is happening. Now you've got
can I ask you a quick question?
$20,000 per enrollee, which is an extremely high price tag for this coverage.
Let me ask you a question here. How does Biden have the regulatory or economic fiat authority to say, okay, all tests, your insurance is going to pay for them? How does he have that authority? Because in insurance, so every year, people that are covered by insurance get a big, thick booklet, or now it's all online, of what the insurance will and will not pay for. And that's how they arrive at your premium. How does he just assert himself in that contract?
Well, HHS gets to make these decisions. And
how?
Because we now we've gotten to a place where these unelected people, these bureaucrats, have an unintended amount of power, and they use emergencies to really capture more. So now they're going to force the system to pay for all of this, and it will absolutely show up in your renewals. When people scratch their head and say, why is it going up yet again? This is the kind of reason.
So let me give you another example. One of our doctors that we have on the show will always say, well, diabetes, being overweight is as big a threat to the health and well-being of Americans as COVID. You're being overweight, you can have heart attack, stroke, diabetes.
Yep.
So could President Biden say, hey, diabetes is a huge threat to American health? All insulin shots, medicines, et cetera, are now free, covered by your insurance, no deductible.
Well, that's what they've proposed as a solution to high-cost drugs for Medicare. With this big increase in Medicare, they're saying, oh, we're going to make it so nobody has to pay more than $35 for insulin. They're not turning around and saying, we're going to actually work to negotiate a better price for insulin. We're still going to allow 60% of the cost of insulin to be waste when we purchase it. We're just going to subsidize that more heavily and make it so that that person on Medicare only has to pay $35 for insulin. Hey, that's good news for the person on Medicare. I'm not against that. But when you realize a monthly supply of insulin has an average cost to whoever the real payer is, not the person paying a copay, but the actual insurer, of $550 a month, and $330 of it is waste, then you got a problem that could be, you could do a way better job than saying we're going to limit the copay to $35, but still allow ourselves to get completely taken advantage of by the system. You could go and eliminate that waste. We're doing that in employer plans on a regular basis, just completely firing vendors that add waste like that to the system. That's what our government needs to do. When you don't allow free market forces to work, this is the result you get. And the solution isn't to just subsidize more and continue to let the system get really raped by unethical players.
Well, one of the things that I always rail against is the one-size-fits-all. So, for instance, you mentioned that since Obamacare in 2014, they subsidized premiums for people making less than 400% of poverty level. And as you mentioned, that comes out to $106,000 for a family of four. And now they're even subsidizing that level. Well, if you're in San Francisco or San Jose, San Diego, Santa Barbara, and you're making $106,000, you're going to be poor because the home prices are $1 million plus. Right. But by golly, if you're in Podunk, Mississippi, you're the richest guy in town.
Right.
And that's the other thing that bothers me. I do know, and this is what I don't get the connection. We only have a couple of minutes. I know that when I used to manage work comp and healthcare for a company I worked for 30 plus years ago, that the doctor reimbursement rates and insurance rates, et cetera, varied by zip code. And so they weren't paying the same payments in Mississippi as in La Jolla, California, you know? But right. It seems like with these other programs, it's one size fits all.
Well, and it kind of defines our COVID approach, employer mandates, et cetera, one size fits all, and that doesn't work that well. That's why we have a republic, although we don't always behave that way. In insurance, we have 50 different countries in the way that we run insurance, not at the federal level, not with these subsidies, but at the state level, and they're really trying hard to eliminate that. And that's what part of this is about. You have 12 states that kind of are holdout states in terms of not taking some federal money to expand Medicaid in their state as a part of Obamacare, because they believe it disincentivizes work. They have various reasons depending on the state, or they have their own state programs that they think are more effective. And so from a federal level, what we see is things like this, where they're trying to reach around those states. And that could happen as part of the Build Back Better Act, but kind of reach around these states, and then we all federally pay to do something in a state that doesn't even want us to do it.
Well, like I said, this whole thing is so out of control, and I wish that people understood that they're cheating, that they're giving. They claim they're bringing down the cost of health care. They believe that they pretend that affordable health insurance is now a reality, but in reality, they just subsidize it. They borrowed money to pay people's premiums.
Hundreds of billions of dollars a year.
How much?
And it's not a couple $100 billion. And it's not even permanent. I mean, these are set to expire at the end of this year. So their hope is that they can get this Build Back Better Act in some form to continue, and then they can get another couple of years and just keep moving us toward a place where you don't see it because what's coming out of your wallet is reduced, but this big medical industrial complex can just continue to grow its share of our GDP in an inefficient way.
Paul, thank you so much for being with us. Love having you on the show. Keep us surprised of that California single-payer health care thing. If it moves through the assembly, whether they'll really fess up that it would cost 4 to 5 times more than they claim it will. We're going to be back. You've been listening to the Andy Caldwell Show.